Adolescent varicocele or varicocele in young unmarried men. I do come across many youngsters, especially around the age of around 16, 18, 20, 22 years of age, who are still, of course, not married, and then they keep experiencing some pain in the testes, and then they get an ultrasound scan done which shows varicocele. Varicocele is basically a dilatation of the pampniform plexus of veins in the scrotum, and this varicocele can lead to increased temperature, which may affect the sperm quality, thereby affecting the fertility in the future. And also it may lead to hypertrophy of the testis, which means reduction in the size of the testis. So these are the two things that can happen. One is the reduction in the size of the testis. It may affect the sperm quality, and the third is that it may cause a dull aching pain. So there is a dilemma that I'm still young, I'm in my 20s, I'm not even decided about my marriage. Should I really undergo any treatment for this varicocele? So varicocele, to treat the varicocele, various options are there. The most common or the most successful type of varicocele repair is the microscopic varicocele surgery, the outcomes of which are quite good. Should you undergo a surgery or not is the question that I'm trying to address here. So we usually don't recommend a surgery at the very first consultation. We always prefer to follow these young men who have significant varicocele. The factors that we see is that yes, if somebody is able to masturbate and give the semen sample, we do sometimes ask for a semen analysis. Most importantly, we do ask for an ultrasound scan now, and we tell to come after 3 months or after 6 months and come with a repeat ultrasound scan from the same center where the first scan was done, so that it will be easy to compare if there are any changes in the veins and the size of the testis. So we monitor the diameter of the dilated veins, we monitor the size of the testis, and if there is any change in any of these over the 3 months or the 6 months time, and also if the pain is bothering, that is the time when we usually suggest surgery in these young men with varicocele. Again, it's not very much compulsory to ask a semen analysis in these young men, because some young men or adolescents practically may not be able to give a semen analysis. So it will be adding an unnecessary psychological burden on them. So we do not force these young men to give a semen sample. So pain, testicular size, venous diameter is what we usually follow, and then very rarely we do ask for a semen analysis. So please consult a dedicated andrologist to get the best opinion on the adolescent varicocele.